Okay, we're going to get started. And so I just wanted to say good afternoon to everybody. My name is Stephanie Verna, and I am the Research and Program Manager at the Injury Prevention Research Center at Emory. This is our first installment of a series within our data literacy series, and we are collaborating with the Georgia Department of Public Health. And so our first session today is going to include Georgia's tool for public health and public policy data analysis, specifically named the Online Analytical Statistical Information System, also known as OASIS. And so here today presenting this tool, we have Fabio Machado, who is a data quality specialist, and he is an OASIS trainer from the Office of Health Indicators for Planning and the Division of Epidemiology with the Georgia Department of Public Health. So in addition, we do have David Austin with us, who is the director of data quality and the analysis team in the Office of Health Indicators for Planning, who will be providing answers to any data related questions that you may have on the material being presented today. So while presenting, if you have questions, you're more than welcome to pop them in the Q&A chat, and we'll get to them as soon as we can. And so without further ado, let me turn it over to our presenter and data quality specialist, Fabio Machado.
Thank you, Stephanie. Hi, everyone. I'm Fabio. Like Stephanie said, I work for the Department of Public Health for the OHIP program. And we mostly deal with vital statistics data and hospitalization data, and our mission is to turn that data into information that people can use. So the way that there's a lot of stuff that we do on the back end, but we publish this this website called OASIS, where you can find a lot of the information that a lot of the data that's been cleaned up and ready for anyone to use. So let me share my screen. There we go. Okay, so the way that you can find OASIS is just to go to your Google search and just type in OASIS, and then you can do DPH or Georgia or something like that. If I can spell Georgia. And it should be the first hit that you get. So it's oasis.state.ga.us, and we're gonna click on that. And this is the front page of our webpage. Quickly, the way that the front page is divided is that we have various data domains. So for example, we have like mortality and morbidity, and inside of those domains, we'll have information about deaths. So mortality information, we'll have information regarding hospital discharges, emergency room visits, et cetera, et cetera. Each one of these bigger headings usually will contain some kind of more specialized data set in there. And just to repeat it again, our data mainly comes from vital records. So the official records from Georgia, and that includes death records, birth records, fetal death records, and induced terminations as well. In addition to that, we also have information regarding hospitalizations, that which is pretty rare for states to have, in my opinion. Like I don't really see a whole lot of states having this information. So you can get a lot of data from that. And also we have some information regarding population from census as well. So the main agenda for the presentation is basically I'm going to go through 4 typical use cases for the website, and I'm going to show you how to use 4 of our main tools, so you can be comfortable with using that when you get a chance to try it out. Also on the main page, we have this how to use OASIS /tutorial. This will, if you click on this, it'll pull up a PDF that basically outlines the same thing that I'm going to talk about. So then I'll just go ahead and I'll get started with the first example, which is getting the teen pregnancy rates for every single county, and let's say for the last like 5 years for Georgia. And for that, I'm going to look under maternal and child health, and I'm going to look for not births, I'm going to look for pregnancies, which is right here on the right side. So I'm going to click on pregnancies, and then you'll get a selection of tools. In this case, I'm going to do click on Get Table here, and this is going to pull up our web query tool. And I'm going to make this slightly bigger so we can see what I'm doing. So as I said, I'm interested in the pregnancy rate. So I'm going to click pregnancy rate here. And then I mentioned teens. So I'm going to loosely define teens as 15 to 19-year-olds. So I'm going to click on 15 to 17. I'm going to hit Control, and I'm going to click on 18 to 19 to select those two age groups. And then for time here, I set the last 5 years. So I'm just going to click on 2021, hold down the mouse button and drag it down to 2017. That's going to select those 5 years. And then I want every single county in Georgia. So for that, I'm going to click on Appling. Just hold down my mouse button and drag it all the way to the bottom. And once I've made these selections, I'm going to click on Get Data. And as you can see, we have a table populated with the pregnancy rate for every county for 15 to 19-year-old mothers. Now, some really interesting things about this table is that if you hover over pregnancy rate, for example, it will tell you how that's being calculated. In this case, it's the number of pregnancies per 1,000 females 10 to 55, but in this case, 15 to 19 years old. So it's taken into account all of these selections that you've made in the query parameters here, right? So if I would select white and black and African American, it would take those into account as well. So it would only pick those relevant populations. Something else to note is that you get the pregnancy rate per year, but also you get a total pregnancy rate. So taking all of the pregnancies that occurred in these years by the population and giving you like a grand rate. Another thing is if you hover over the county names, you'll see a nice little visual display of where that county is. Georgia has 159 counties. I get lost all the time trying to figure out where things are. So this is like pretty helpful. Like, oh, we have a county named Bacon. Who knew? There it is. All right, some other things about the tool. All of the tools will have the certain buttons on the right side here. For example, we'll have this quick start guide. So if you click on that, it will pull up PDF that shows you how to use that particular tool. Okay. We also have another link here called definitions. And if you click on that, then you'll get how the definitions of every measure on our page, on that particular pregnancy page, right? So it'll tell you like, how do we calculate a pregnancy? What is a first pregnancy, et cetera, et cetera. But in addition to that, we'll also include information about like the demographic, like what is considered Hispanic or Latino, for example. And then crucially, we'll also define how we classify a rural versus a non-rural area. And that's in here as well. So all of the pages will have different definitions associated with them. So it's worth looking in there if you have a question about like what's available in this tool. That's a good place to look. Okay, so I have this data. And okay, so I have this data. Cool, I have it on the website. Now I could go ahead and like copy and paste this into Excel, but we also have a nice little save data button here we can click on, and that will download the data as an Excel file. Ooh, let me see. I may have to change my screen. Ooh, wait, how do I do that? Okay. Okay, cool. So I downloaded the data set. You can see that it's downloaded over here. I'm gonna click on it. Open that. Okay, and you should see a copy of the same results that you saw on the webpage. So you'll see the pregnancy rate by the county, and down at the bottom, you'll see that sometimes, sometimes on our queries, you'll see notes on the page. Like for example, you'll see these asterisks. This just means, in this case, that we're not displaying events that occur less than 4 times, and it has to do with the statistical validity of that rate, for example. One other thing to take note of when looking at the Excel file is that the ordering, the alphabetical ordering, it's not the usual alphabetical ordering, I would say. It's like the old school alphabetical ordering. So for example, you'll see like McDuffie comes before Macon and before Madison. And that just has to do because when you expand McDuffie, right, MC Duffy, it's supposed to expand into MAC Duffy. So it usually will come before any of the other MAC, Macon, for example, or Madison. So just be wary of that. If you're ever joining this data set to something else, just make sure that the ordering is in the same. The ordering is the same. Okay. So that's web query. It's pretty simple, but it's very powerful because you can get like everything that you see on here. You can query by everything you see on the screen. Okay, I'm gonna go back and do a map now. I'm gonna show off the mapping tool. So I'm gonna click on that big OASIS button at the top. It's gonna take me back to our home page. And for this, I'm gonna do the percentage of low birth weights by census tracts. So low birth weights will be contained in births. I'm gonna click on births here. And this time I'm gonna click on Get Map. So this is our mapping tool. For the most part, it's very similar. It's pretty similar to web query. You're gonna make certain selections and you're gonna go to the bottom here and click Get Map, and it's gonna populate the map for you. So the selections that I'm gonna make are, instead of number of births, I'm interested in the percentage of births. The mapping unit I'm gonna pick is gonna be the census tracts. And for this, we're gonna limit it to 1 county. So I'm gonna pick DeKalb. And what I did there is I just typed in DeKalb in here. I clicked on in the box here and I pressed DEK, and that took me to DeKalb. Then I'm gonna leave time by like that, leave it like that. Everything else pretty much stays the same except for birth weight. Here I'm gonna select anything less than 2,500 grams. That's what we consider low birth weight. And then I'm gonna click on Get Map. And you should see, yeah, this is a map of DeKalb County, broken by census tract. So we can zoom in and take a look at this map. You can see that up top. Oh, I messed it up a little bit. It's okay. I can always go back to the bottom here where it says full extent or previous extent here, and it should fix the map to where it was before. I'm gonna zoom out a little bit. I like that, like this, so we can see the whole thing. So I'm gonna go back to this. Okay. So a couple of ways that you can zoom in and zoom out and move the map around. Clicking on this magnifying glass with a plus symbol on it, you can drag an area like this as a rectangle, and that will zoom you into that area. If you want to move around and pan around the map, you click on pan button here, and that will let you. Oh, I didn't click on it. So let me actually click on that. And now I can drag the map around to wherever I would want to look at. You can also press this plus sign up here to zoom in a little bit more into an area, for example. So the map, so now you have this, you have this map of census tract, but it's really hard to orient yourself when it's just like these polygon shapes. So on the left side here, we have a bunch of layers that you can overlay or underlay on the map. And one of them is a street map. It's on the left side here. And you can see now we can see roads, we can see we can see roads, we can see like city names and stuff like that. But the data is it's not here anymore. That's because by default we set the data layer to like 0 opacity. So we want you to control how much of the data comes back in by sliding the slider at the bottom. So as you can see, as you slide this towards 100, the data becomes more visible. So let's say that you're interested in this specific area here, and you want it to look kind of like that. All right, you have your map. You have it, pointed exactly where you want it to be at. In order to save the map, we click on Save/Print Map all the way at the top here. And crucially, it tells you to disable your pop-up blocker. If you don't, it's just gonna block it. But any browser will just let you, just go ahead and allow pop-ups from the website. So I'm gonna click Save. It's gonna take a second. And now you have a PNG of the map. And one way that you can save this to your computer, stop. Okay, close all this. Okay. So you can like right click on this, save image, and you can save it to your downloads folder. But you can also just like click on this and drag it to your desktop, or whatever folder you want to put it in, and that actually saves it to your computer. So I usually end up doing this this method of saving maps. Okay. Okay. Now, some things about the mapping tool. Whenever you select a small geography, like a census tract, the data is going to aggregate by 5 years automatically. And that's because usually there's not enough events in a small geographic area, like a census tract, to generate like a complete map. So by default, we aggregate it by 5 years. So in this case, you can see that it's 2017 through 2021. Now, if you wanted to see a progression of maps, we can do that on this tool as well. So for example, if I'm interested in like the last 20 years for the same area, I can select all of this. And if I click Get Map, actually, kind of like how you saw earlier with the ages, where it was putting together like from 15 to 19, if I leave it like this is going to do 2002 to 2021. And we can see what that looks like. But this isn't exactly what I want. I want to generate 4 maps, for example, 4 maps of 5 years. So in order to do that, I'm going to click on Show Trendable Maps here. I'm going to click Get Map. And now we should see, I'm going to zoom in a little bit, bring in those, bring in that street map layer, overlay my data. Cool. And now we can kind of use these buttons here to go through, cycle through the 5-year periods. Right. So now we can see how the data is changing over time. And also really cool, if you save, if you click the Save/Print Map, this is gonna download all 4 maps for you. So we should see 4 screens coming up. And 4. There you go. Just reading my notes here. Oh, one other thing you can do on here, besides like all of this stuff, if you don't like this color scheme, we have some limited color options here. So instead of yellow and brown, you could do like a blue color scheme here. And if I get map, it should look a little bit different. The data is still the same. It's just a little bit of a different color scheme. same thing. Okay, so that's a mapping tool. Let's do, so the next tool I'm gonna highlight is called our animated charting tool. And for that, we're gonna do population counts. So population is all almost all the way at the bottom. It's right here, I click population tool. And I'm gonna click on get animated pyramids. And these kind of graphs are called population pyramids. They're widely used in like demography. So basically, once I generate one here, let me pick an interesting county. I'm gonna click Clark here. I'm gonna click Get Pyramid, and this is just gonna show the population by age. So as you can see, so if we, I'm gonna zoom in a little bit on this. So we can see like we have this graph that's divided into a left and a right side. On the left side is on the y-axis here, it's going to be age groups going from 0 to 85 plus. On the bottom is going to be a count, a number of people that fall into that age group. On the left, it's going to be males. On the right, it's going to be females. So interesting, like Clark County has a very interesting distribution of ages because it's a college. Athens is located in Clark County, so it's a big college town. So you're going to see a lot of 20 to 24-year-olds in the population pyramid. But if we do it, for example, if we do all of Georgia, for example, when we get pyramid, you can see that Georgia has a bit of a different shape, right? Most of the population is young, with a few elderly, as you would expect. But now, so this is called the animated charting tool because we can move forward and backwards in time. And if we click this animate button, it's actually gonna generate, it's actually gonna move through a bunch of these graphs. And you can see how the population is changing over time with a nice little animation. If I click stop here, you can move forward and back with these buttons here. So you can move at your own pace. If you like a particular pyramid, if you like a particular image, you can save that image. We also include the data at the bottom, and it's broken down by years of age and male, female, and white and black. And you can save the data with a save data button as well. And also something that we added that's pretty new, you can also save the animation as well. So if I click here, it takes a little bit to download. Oh, there it is. And this actually looks really nice when you put it into a PowerPoint presentation. Let's just do this. Let's just say you have this PowerPoint presentation, and you just, this is the GIF I just downloaded. I'm just gonna drag it in there. And when you look at it, yeah, it's actually nicely animated. So I mean, it looks pretty cool when you do when you include it in a PowerPoint at least. Okay, yeah. So that's population pyramids. And then the final tool I'm going to go over is our trending tool, and that one basically generates line graphs. So change over time graphs. And for this, we'll do drug overdoses. We'll do mortality due to drug overdoses. It's going to be over here under mortality and morbidity. And for this, I'm going to click on Get Trends. Okay. And just as I'm just going to leave everything as default. I'm going to hit Get Trends here, and we'll see this nice graph, this line graph show up. You'll have the graph at the top, and then you'll have the data at the bottom as well. this graph will also have like tooltips over it, so you can see the data that's underlying it. And let's look at, for example, instead of counties here, let's look at some public health districts. Let's look at Georgia versus Rome. Let's get trends and let's see what that looks like. This is total number of deaths. I don't want that. I want death rate. So take the population into account. Actually, let's do age-adjusted death rate. Okay, and then when you take them into account, you can see this district has higher death rates due to drug overdoses compared to Georgia, for example. Now, that's the district. You can also, from this specific menu, if you double click on the district here, you'll also get all of the counties under that make up that district. So you can set up a comparison where it's Georgia, Rome, and then let's just pick like 5 counties here. And oh boy, this looks like a mess right now. Well, this kind of jumbling, like zigzag patterns usually happens when there's not a whole lot of information, because these are rates, they depend on the underlying events, so instead of doing a 1-year aggregate here, I'm going to click on 5-year aggregates, and this should kind of smooth out these lines a little bit. So these are just like rolling averages of the last 5 years. And now we can see that this is Georgia's the lowest rate. This is the district, and then you can see like each individual county, what their rates are for drug overdoses. And also you'll see that the x-axis here has changed to include like 5-year, the 5-year time span. Right, all the data is there. And then one last thing on here is that if you double click here on the y-axis here, you can actually change the minimum and maximum access limits here. So instead of 44, for example, maybe I want like 100. If for whatever reason you need to match like another, like this is useful if you need to match another graph that has like the same axis or something, but you can actually change it on here. Okay, I could show off one more. We didn't really go into any like hospital discharge information, but I'll do something really fast. So I'm going to look at emergency room visits, and I'm going to do population pyramid because I'm interested to see, like, let's say I'm interested in what age group is more goes to the ER the most for falls, for example. So whenever you're dealing with like causes of death or cost of hospitalization or an ER visit, those are going to be, you're going to have to select them from this cause selector menu here. And this is divided in like a hierarchy of parent and child, right? So if I go to definitions, you can kind of see what this means. Falls, for example, is under external causes, and so I'm going to click here, and you can see that under external causes, there's a bunch of causes for an ER visit. I'm interested in falls, and that has like these ICD-10 codes and ICD-9 codes that are associated with it. There's also some information about the distribution of some of the ICD-10 codes in here as well. So I'm going to go back here, back to the tool, and instead of all causes, I'm going to go to external causes, which is at the bottom, and I'm going to click on falls. And I'm just going to do all of Georgia, and I'm going to click Get Pyramid. And in this case, you'll see that there's actually, probably expecting a lot of falls happen in an older population, but also like in toddlers, which isn't like the first time I saw this, I was like, oh, yeah, it makes sense, but it only makes sense after I saw the data. It wouldn't be like the first population I would think of when considering, who goes to the ER for falls, for example. And that's pretty much the standard presentation. I'm happy to take questions or if you guys want to see anything else. There's a couple of other tools that we have available. If we have time, I could go through those as well, Stephanie.
Yeah, absolutely. There are actually two questions that I didn't know you can address. So specifically, we had somebody ask if you can do a trends for all cause of death, all of Georgia, 1994 to 2021.
Oh yeah. Oh, sorry. Let me go back and show you what I just did.
Yeah,
So
sure.
I went back to the main web page. Yeah, we can definitely do that. Went back to mortality, and then I went to trends. So we're just doing number of deaths.
It said all cause deaths, all of Georgia, 94 to 2021.
Okay, so that's pretty much the default. So I didn't have to change anything. I'm just gonna hit get trends, and that's that.
Okay.
Now,
Great.
if they mean like you want multiple causes of death, so for example, you want to compare like COVID-19 to, let me see if I can, where is it? To the flu and to like pneumonia, bronchitis, and everything else here. You can also do that. We limit the number of selections you can make in this tool because otherwise you just get like, it's just going to be like too many lines, right? On one graph, it's going to be overwhelming. But you can definitely do this, for example. And you can see like this black line is COVID-19. These are the number of deaths. And it just like overtakes everything else that has to do with any other respiratory disease here.
Okay. Well, thank you.
Sure.
Perfect. And we have one more question from one of our guests. So for population data, is there data on refugee and or immigrant populations in Georgia?
Our tool does not have that. We just do the county estimates, or well, the county, what do they call it? The county population. Yeah, it's like their estimates for the county. So we just have like information on age, sex, ethnicity, race, and yeah, age, sex, ethnicity, race, and the count at the county level. It's all we get.
Okay.
Yeah,
Great.
if you, oh, sorry, I was gonna say like if you need that information, I think you're gonna have to hunt it down on the census, on like the census website. And I know that can be a pain because they have so much information on there. It's hard to find stuff a lot of the time. So
Of course. Okay. Perfect. And we have another question that just came in. Is there a plan to add more current data from the YRBS and the BRFSS to OASIS?
there is, yes, there is. That has, so the YRBS data, yeah, we're looking into getting it updated and put on OASIS.
Okay, great. All right. And we do have one more question from our attendees. So can you do a trends for overdose and suicide all of Georgia the past 10 years?
That's a really good question. Okay. Very good question. Actually, so you won't have overdoses how they're defined here. This is like this is a very very specific way to define overdoses in this category. It's like it has to do with like opioid overdoses or like synthetic, stuff like that. And those are not usually together with suicide, but you can get a proxy. And I'll show you how you can kind of do that. So I'm going to click on Get Trends, and we'll just do number of deaths for now. And okay, so what I'm going to select are poisonings, right? Poisonings. So that's going to be here, poisonings, and COVID-19, which is all the way up here. So I'm kind of bouncing around here. Poisonings, COVID-19. Now, poisonings includes things like alcohol poisoning. That's crucially the biggest difference. Like, it includes a bunch of other stuff. And yeah, you can definitely see that number of deaths aren't as high as COVID-19. But I want to show you something else. Now, just because the number of deaths aren't as high doesn't mean it's not like public health concern. I'm going to use another tool for this. So one of the other tools that we have on here it's under leading causes of premature death. I'm going to click on this, and I'm going to get this YPLL pyramids. And for this, I'm going to leave everything as is. So what this is going to do is going to generate a population pyramid, and you'll see how many deaths are occurring per age group. Let me zoom in a little bit here. So you can see the percentage of deaths in that age group due to this cause of death. So due to COVID-19, 5% or so of 70 to 74-year-old white males died from COVID-19, for example. Now, interestingly, years of potential life lost has a cutoff of 75 years. So anything that's above this horizontal line doesn't count towards like our measure of years of potential life lost, let's say. But still, we have these ranked from 1 to 10. So the number one cause being the most years of life lost. And even though there's this cutoff at 75, there's still a lot of deaths happening in younger age groups. Now, when we look at something like accidental poisonings, which is the second cause of death, you can see that the population pyramid for that looks way different than for COVID-19. You see like a lot of deaths occurring a lot earlier. Therefore, the years of potential life lost measure gets weighed more. That's more years lost earlier. Did that answer the question? Sorry. I
know that specifically we were like, I know they wanted to know specifically about the overdose and suicide deaths. So that might not be able to be specific to this, but we can go further in and I can contact the individual so we can get that as much as possible, if not.
Sorry, so also in here is also self-harm and suicide. Sorry, I totally forgot about the suicide portion of it. Yeah,
no,
you can also get suicide. Actually, we can do suicide. I'm sorry, that was my fault. I got caught up in like COVID-19 for whatever reason.
No.
Yeah, that's poisoning and suicide. There we go. And that's poisoning. And
can you do the last 10 years specifically?
Oh, yeah. Yeah. So to do that, by default, it's going to select all years. So I'm going to click on 2021, just click, hold it, and go to 2010. Okay, usually what I'll do is like I'll hold shift and I'll just press like the down arrow to get that selection going. We can do that like that. The last 10 years. There's the data as well.
So Stephanie, if I can interject for a second. This is David.
Absolutely. Hi, David.
Yeah. Hi. So the specific question they're asking, how many people died of suicide from drug overdoses? This graph won't actually show that. This graph shows the number of suicides and the number of what is it, drug overdoses? What do you select, Fabio?
Poisonings.
Poisonings.
and suicide.
So this is not like the intersection of the two. This is just the number of poisonings and the number of suicides. So right now we haven't split suicide by cause. So for example, if you scroll up to the top, and then scroll down, and all of these are accidental until you get to, we call them unintentional injuries. So until you get to unintentional injuries, all of those causes are accidental. Beyond that, it's all with a specific intention, either suicide, homicide, or legal intervention. So right now we are not able to do that specific thing where suicide due to drug overdoses, but we are working on a tool specifically for injuries. And at some point in the future, you'll be able to split it up by intention. So for example, we'd know suicide, and then we could choose the cause being drug overdoses and get that specific graph of suicide due to drug overdoses. Does that make sense?
Yeah, thank you so much for just specifying that. That's super helpful. I appreciate it. Okay, so we have a couple more questions that came in, so I'd love to get to those. So we did have somebody ask, maternal deaths, is there any plan to have that data available?
David, you can handle that one.
Yeah. So we did have maternal deaths on OASIS up till a few years ago, and then it's been taken over by MCH. So right now we don't have it on OASIS, and probably not going to be anytime in the future. So I think MCH has a group that's working specifically on maternal deaths. So if you want to get information on that, you'd have to contact MCH.
And MCH stands for?
Maternal and Child Health.
Thank you so much. Perfect.
Yeah, the person who heads it is Michael Bryan, Bryan, Michael Bryan. So you can contact him, and he'll be able to give you the information.
Okay, perfect. So our next question, is there any way to visualize the mechanism of death on OASIS? So specifically, this person really wants to see, they want to identify firearm deaths.
So it's kind of what David said. We don't have
Right.
that just yet.
Okay. So if you go to causes and look under external causes, you'll see something called accidental shooting.
Yep.
So that would be firearm deaths due to accidents. Now, if you want to know firearm deaths due to suicide, we don't have it at the moment. But like I was saying earlier, we are planning to put up an injury specific page where we'll separate the mechanism from the cause. So you could choose a specific mechanism, like, for example, firearms, and an intention like suicide, and then you'd know firearm deaths by suicide, or you could choose all intents and you'd get it by homicide, accidental, as well as suicide.
Okay, perfect. So I just wanted to note that in a couple of our next series, we do our Georgia VDRS. And so that series, we can find a little bit more information on the intersection of suicide and overdose. So if you asked that question, that is in a forthcoming series in the future. So hope to see you at that one specifically, and we can get that question answered through that as well. So thank you so much to our guest for providing that information. We have, yes, and also we will go over firearm deaths within the Georgia VDRS system as well. Thank you so much. Okay, so one of the last questions that we have is sexual assault tracked using OASIS?
Not that I know of, unless there's like some type of ICD-10 code that tracks that.
Yeah.
But it would have to be like a custom query.
Custom query, right?
So, yeah, I shouldn't have forgotten to mention this. Like, so, like our office is here to like assist epidemiologists from all over the place. So like, feel free to contact us if you have questions. For example, like a custom query like that, feel free to reach out to us. Our contact information is here. It says contact us at the bottom of the page. It'll shoot us an email, or you can also provide feedback. We check that every week. Yeah, feel free to give us feedback and contact us, because yeah, we're here to provide information to the public.
Right. Yeah. Just to add to what Fabio says, the whole OASIS system is built upon our departmental data repository, which includes, like Fabio said, the vital records as well as hospital discharge, ER visits, and a few other sources. So we have about 100 million records totally in our repository, and about 15 million injury records covering, the whole range of injuries. And we've summarized the data with specific causes on OASIS. But if you need very specific information on a very specific cause, we have it organized by the underlying ICD code. And if you give us a specific case definition, we can look that up. And like Fabio said, we'll be happy to assist you with giving you numbers or whatever else you need.
That's actually super helpful. So if your question was not answered within and you have something very specific information that you would like to find out, you're more than welcome to contact the individuals that put together this information so that they can get that specific query to you. So that's super helpful. Thank you so much, David and Fabio. At this time, I don't have any questions. If there are any questions that you guys have, if you want to put that in the Q&A box and we can address that as soon as we can, I will give you about 30 seconds if you would like to do that. Let's see here. Yeah, specifically, got a question. So can you cover the DPH data request portal? PHIP?
I don't think I can, mostly because my account is as a data fulfiller, or I don't even know what the actual term is, but like so my account is a little bit different from what someone that makes a request. But you can find it. Let me see if I can find it. Georgia DPH. Oh wait, I can get to there from here. Let me see, where do you do that? I'm just gonna search for FIP request. Yeah, here we go. Okay, cool. Click here. So this is the web page where you would go to make a request for us to fulfill.
Perfect.
Yeah.
That's super helpful as well. This is being recorded, and we do have information that will be sent out to individuals when we do get that approved. And so information on how to submit a data request and the directions and the recording can be put out. But as always, we are going to wait until we do finish with the series to put this stuff out, just so that if you're waiting, that's kind of what we're going to be doing. But if there are any more questions we have a couple minutes to address them. So go ahead and put that in the Q&A. If not, I didn't know, Fabio, if you had anything else you wanted to let us know, or David.
Yeah, just wanted to say that the FIP is for people who are not inside DPH. So if you're already in DPH, we can give you direct access. You just have to email us. We'd give you what you need. And we can even give you direct access to the database. So the FIP is only for people who are not employed by DPH. It's for those outside. Just to clarify that.
Yeah, that's super helpful, because we do have some DPH employees on the call, which we do appreciate. So thank you so much. All right, one last moment for if you have any type of question that you would like us to address. Let's see. Any more questions? All right. Well, I just wanted to say thank you so much to our DPH friends, Fabio Machado and David Austin, for helping us. And like I said, this is one of a series of 4 different things that I guess sessions that you can go ahead and join. You're more than welcome to go ahead and sign up, and you can send the series to others. We do have a couple other sessions, and they just happen to be, the next one is February 22nd. And then we have March 8th, and then March 22nd. And so our next session is going to be on EMS and the trauma data set. And so if you haven't signed up for that, it is the same exact registration link. You can send it around if there's anybody that would like to register. They're more than welcome to come hang out with us and learn more about that data. But I just wanted to say thank you so much. And I hope everybody has a great week, and we hope to see you in our next installment. Have a great day, everybody.